I'm the third D.
Yeah, yes.
Dynamic healing with the right treatment protocol. I think an important thing is that clinicians are really expecting simplified solution to improve the leg ulcer treatment. It's a problem because chronic wound is complex, because the patient is complex, because the wound is complex, because we have a lot of comorbidities, especially when you have to manage elderly patients like me. It's also a problem for nurse. It's a predominantly nurse-led discipline, but you have also around the nurse many healthcare professionals involved in the leg ulcer wound management, doctors and doctors from different specialties. You have also dressing and bandage, and these dressing and bandage are often switched. And we have also a problem with the differential diagnostic of this leg ulcer. So clinicians are looking for a simplified solution. If we look at the last market survey conducted by the foundation from Urgo, 40% of clinicians declare they need more simplicity for use. It's in France, doctors, and in Germany too, and in Spain and in UK, nurse. Everybody needs that. The ideal treatment protocol, according to clinicians, is first meets the priority one, reduce healing time. Also addresses the patient quality of life needs and relieve pain, improve quality of life. It's very important and also, like Christine explained, enables a high level of patient compliance and adherence. And if we look at the result of the studies that Marco Romanelli proposed tomorrow, relieve pain and close the wound, improve healing are the most important thing we expected. How to improve the care of venous or leg or mixed leg ulcer? With a simple protocol of care to reduce healing time. First of all, you have to consider the etiological treatment. And second, you have to consider the local care of the wound. If you consider etiological treatment, you need reliable continuous compression. And why is this continuous compression? Because applying an external pressure to the limb is able to improve venous hemodynamics and promote ulcer healing. You can have a look on that on the EWMA guidance and the Cochrane review. Multi-component bandage are more effective in achieving ulcer healing, perhaps due to the ability to maintain pressure and stiffness. Second thing, the local care. Use an MMP modulated dressing is very important. And why use this MMP modulated dressing? Because excess of level of MMPs in venous layer are correlated to delayed healing. And an MMP modulator rebalances this enzyme. In the EWMA guidance, also you find finally there is some evidence that some modern dressings and procedures that modulate matrix metalloproteinase may be effective in improving healing rates. So how to improve the care of venous or mixed leg ulcer with a simple protocol of care to reduce healing time using the combination of Urgostat and Urgo-K2. Urgo-K2 is for the etiological treatment because it's a reliable continuous compression, and the local wound care with Urgostat, which is an MMP modulator dressing. If we look at the compression and venous leg ulcer, if you look at the Cochrane review, there is some evidence comparing compression bandage. On this last meta-analysis published on 59 randomized trials, multi-component compression is the most efficient to heal venous leg ulcer. Multi-component is better than simple component bandage compression system. Multi-component bandages with 3 components and 1 elastic bandage is better than compression with 3 components without any elastic bandage, with a risk ratio which is 1.83. And a multi-component bandage, 4 components, is better than short stretch with a risk ratio of around 1.31. proposal from Urgo is Urgo Cadeau, which is dual compression. The white band is a double one, protection and short stretch. The second one, the orange one, is an elastic one and a cohesive one. It's a multi-component bandage available and validated throughout controlled randomized study. Reality is the study, last one published by Urgo on UrgoStart. UrgoStart's efficacy is observed in real life on now 10,000 patients with leg ulcer, diabetic foot, and pressure ulcer. This study, just published in Journal of Wound Care, pulled data from 8 observational studies. The indicator was the time to complete closure and also the time to 50% reduction of the push score. The method used are a very classical Kaplan-Meier model and subgroup analysis depending on the Margolis score. Patient is essentially leg ulcer, 77.3% leg ulcer, but also some diabetic foot and also some pressure ulcer. The country involved in this 8 observational study are France and Germany. The result shows that UrgoStart reduces healing time of leg ulcer by 100 days on average. If you consider the average time to close leg ulcer, in the health insurance database from France, it's around 200 days. If you use UrgoStart, the result in real life, in this reality study, it's 112 days. The reduction is around 100 days. It's very important, and it's totally consistent with the controlled randomized studies published in 2012, the challenge study, which was a controlled randomized study, double-blind. It's very important because also in the reality study, sooner UrgoStart is initiated, the shorter the healing time. You compare UrgoStart used as second line after one or more neutral dressing to UrgoStart used from the beginning of the management of the leg ulcer, and you even shorter healing when you use in first line. So it's very important when initiated UrgoStart as first line treatment, you save more time. In summary, if you consider the dynamic of the management of leg ulcer are a big burden for patient, healthcare system, and clinician. Clinician acknowledge that leg ulcer treatment could be optimized. Reducing healing time of leg ulcer is a priority for everybody. Reduce healing time requires continuous compression and patient engagement. Reliable compression and effective wound care is the key to reducing healing time. And combining UrgoStart with Urgo Q2, clinician may reduce healing time and in the reality by 100 days on average. Thank you for attention.